Hello, I'm Kyle Bertia, a former Romanian orphan and a current fourth-year medical student in the United States, and I'd like to welcome you to my presentation on orphan health. So, for this presentation, I'd like to address why orphan health matters in 2020. I'd like to help you understand the conditions that I and other children faced in the Romanian orphanages, and understand a bit about the neuropsychological outcomes this can have on a child. So why do we care today? Well, the UNICEF estimates that there are about 15 million orphans in the world at the moment, with numbers particularly rising in Africa. And just within the United States, the CDC estimates that there is about an $800,000 lifetime cost of all forms of child maltreatment per person, which includes issues with law, issues with economics, and their productivity losses. And in all, this estimates out to be about a $2 trillion annual loss on the United States economy due to all forms of child maltreatment. And even on a personal level, these people who are mistreated as children show lower education, lower employment, and lower future financial success. So to give you a bit of a backstory, this is the country I'm from, Romania, in Eastern Europe. It's a Latin nation, and you can see a bit about the history there. Most importantly, it was a communist nation up until 1990. So this is the city I was from, the little red dot there. It's Brăila. It's, I think, the 11th largest city in Romania. And to give you some perspective into how the orphan crisis happened, why there was such an issue. This is Nicolae Ceausescu. He was the second communist dictator of Romania, and he was not considered a very great person. He believed in this idea of forming a new Roman Empire, essentially, a Latin Empire in the East, and Romanian racial purity. So to that effect, he really wanted to increase the population almost by doubling it. And to do that, he banned all forms of abortion below the age of 45 at one point, unless you had a medical condition. And he also made it punishable by death for doctors to perform abortions. And if you were a mother under the age of 45, or not a mother yet, under the age of 45, you would have mandatory gynecological exams monthly until you got pregnant to basically assess why you weren't pregnant yet. And then at some point, the marriage age in Romania was also set to 15 for women to further try to encourage childbirth. And they also gave awards in the communist bloc so that people who had a certain number of children, typically 5, were given awards for being hero mothers for bringing that many more bodies to the communist regime. And this didn't turn out the way I think he was hoping. The child mortality rate in Romania was very high at the time, and the abortion rate actually was also very high, even though it was completely illegal. And it also caused massive problems in the economy and a huge orphan crisis. And in the end, on December 25th, 1989, Ceausescu was the last person executed in Romania due to his crimes against the country. So what did this do? Well, it created the adoption crisis, which was pretty much ongoing from the time the Communist Union fell to pretty much the mid-2000s. There were a lot of concerns over people black market adopting children, basically trafficking them. And this led to issues where the Romanian government banned adoptions internationally several times, and I luckily managed to escape that by being adopted in 1996 before the restrictions went into place. This also was at the behest of the European Union trying to get Romania to basically fix the problems with the orphan system so that they could enter the European Union. There was also issues with not enough people being able to adopt children from Romania. My parents were pretty typical white heterosexual Christians, and if you weren't that, you would be very hard to adopt from Romania at the time, and even still pretty difficult today. You could not adopt if you were a single parent. You could not adopt if you were in a homosexual relationship, and if you weren't a white Christian person, it was still very difficult due to the way the government worked at the time. And the actual process to get me adopted was quite an ordeal for my birth parent, or my adoptive parents. They've told me a lot about it since, and essentially it involved thousands of dollars in bribes. All forms of government wanted to delay people and keep them in the country as long as possible so that more American dollars were flowing into the country. So the way you got out of that was by bribing, which essentially was paying more money so that you could speed up your process. Even then, it still took them months to go through the whole process. Lots of home checks to determine that they were valid people to adopt, mental health screenings for them, background checks, and then even to get me back to the country involved lots of checks for infectious diseases or my health status and that sort of thing. And even more importantly, my parents didn't get to choose me specifically. This woman here, Rodica, was the assigned person, and that is a little picture of me, who was assigned to basically choose which child my parents would get. And she was allegedly a very nice person, but it's just how the system worked. You couldn't choose who you got to adopt. Now, this is a picture of my orphanage. The top is the outside, the bottom's some room on the inside. It was a very poorly staffed facility. There was apparently about one doctor in total for the entire body of 120 children, and 2 external nursing staff to help run the place. So essentially 3 staff members were treating and caring for 120 children at the same time, which is a ratio of 40-1 staff for children, which is not a very good ratio to have. They also really weren't given very many resources. You can see in the pictures it doesn't look like there's a lot going on, and for the most part there wasn't. I was fed mostly grain-based products like gruel, grits, sometimes tea, maybe powdered milk, occasionally. They also had issues with the electricity and the water in the country. There was restricted for sometimes days where you wouldn't have electricity, or hours of the day where you couldn't get access to hot water or any water at all, just due to how resource poor the entire country as a whole was after the communist regime fell. And occasionally within these slides you'll see sprinklings of newspaper clippings that my parents can't tell me where they got that help represent some of the issue from the 90s. This is actually the upper right there is a picture of the doctor who is basically the orphan director, and at the bottom there you can see the equivalent of a playground in my orphanage. So there wasn't a lot going on. The children were very poorly stimulated, and my parents said that they mostly observed the children practicing self-stimulating behaviors like rocking, staring into space, that sort of thing. The children were also had very poor nutrition just due to the nature of the lack of resources. So even if they wanted to, most of them didn't have the nutritional stability to, say, play like a normal child should. And they also had an issue with just how understaffed they were. A lot of the children that were older were tasked with taking care of younger children, while both the older and younger child were needy and had no resources. So not an ideal circumstance all around. And to put a little bit of perspective into this is actually a picture of my birth mom in the middle there, with my 2 adoptive parents on the side. Her name was Monica, or it probably still is, Monica Unganiru, and she was a young single woman in college without any sort of social supports, because Romania, being a heavily Christian country at the time, did not favor out-of-wedlock childbirth. So she wasn't given any supports, no one wanted to help her. Her family kind of pushed her out, so she essentially put me up for adoption because there was no way she would be able to take care of me. And apparently at the court trial to have custody transferred to me, or to my parents, the court there was not as professional as you would hope that a court would be. They told her lots of things in Romanian that were equivalents for derogatory words for women who having children out of wedlock. So as you can see, just based on this picture, though, my parents actually had to meet her in order to transfer custody of me, just due to how the Romanian process worked, which is kind of interesting. So when I was adopted, I was severely neglected in all sorts of areas. You can see here on this growth chart that I sort of just plotted some points on. I weighed 14 pounds when I was adopted at 11 months old, and I was 25.5 inches long, which, based on these 2 red points, are severely below the curve. In fact, one of the points is actually within another portion of the chart, which indicates to me that the people designing this chart didn't expect somebody to have that low of a weight at that time. So not great. Since I had so little stimulation, I essentially wasn't acclimated to any sort of attention, so I responded very poorly to being bothered and touched and that sort of thing. And to the point where when they brought me back to this country and put me on a plane, it was a disaster, allegedly. I was not happy, and neither was anyone else on the plane, because I had never been just that sensorily overloaded, and I basically got flooded with sensory information that I'd never experienced. So it was an absolute train wreck. To go into a little bit about my actual medical problems. We didn't have any immunization records when I got adopted, which meant that, as you can see on the right here, I had to have an up-to-date immunization record. So this is actually the original sheet of paper my mom wrote stuff on when she got my Tetramune Vax back in the 90s, and it's kind of cool that she kept this all the way until now. I also apparently at some point had chicken pox, although we're not really sure and can't verify that as well. So I believe I still got the vaccine for chicken pox anyway, even though I may have had it in the orphanage. But you can see how in that sort of close environment, once one child gets chicken pox, probably everybody else is going to get it, along with every other condition. So who knows what other infectious diseases I had and then got the vaccines for as well. I also had bronchopneumonia when I was adopted, which started the long pathway of me having repeat pulmonary infections over the course of my life. I also had rickets, which is severe vitamin D deficiency, and this has had lasting effects on my skeletal structure even today. If you were able to see my legs right now, and unfortunately I don't have any x-rays from the last decade or so, but I still have impacts on my tibial structure. It bows a little bit, and my chest actually still has a bit of the pigeon chesting remaining from when I had rickets. So these severe nutritional deficiencies have had lifelong ramifications on my health, and may have more in the future that I don't know about even yet. So after my adoption and when I was brought back to the country, allegedly I basically since I had no sensory stimulation, was very curious about everything. I was trying to reintegrate into the world as a functioning human being like a baby should, and because I never experienced anything, most of my time was spent staring at things, because that was about as much sensory processing as I can handle at once. So they would put me in the yard, my parents, and then I would just sit there and stare at things. I wouldn't do anything with the grass or the outside because I just had never experienced it. I had no way of understanding how to handle that. I also had some pretty disorganized attachment behaviors. Sometimes I was extremely reactive against my parents and pushed them away, and I was very argumentative. Other times I was extremely caring and loving to them. And it had this sort of weird flip-flop that caused a lot of hardship for me and my parents growing up. And it also led to me having sort of an atypical family construct, which led to a few issues growing up. My concept of family is altered so that, I don't believe that somebody has to be born into a family for them to consider a real family, but what that does for me is that I didn't think of new people in the family as automatically friendly family to me just because they were supposedly in my family. So I sort of had a weird distrust but also trust of various people depending on, I guess, my own mood at the time. It's sort of hard to remember exactly what I thought as a child. Here's a couple of other problems that I don't believe I ever experienced, but, never know. A lot of children were getting congenital iodine deficiency syndrome just because of the lack of nutritional resources, which can cause severe neurological outcomes. There was a hepatitis B epidemic because children weren't being tested. So a lot of children ended up getting hepatitis B, and when I came to this country, had to be tested for it. There was also a serious problem with pediatric HIV in Romania, to the point where 95% of their new HIV cases within the country were actually pediatric cases, not adult cases. And the reason for that was they were using blood transfusions to try to nutritionally rehabilitate children who had been in an orphanage, which I'm still not sure, and I'm not able to find any information about why they decided to do that instead of funding food for orphanages, but apparently somebody thought that was the right decision. And the reason people kept getting HIV from it was they were basically trading syringes around the hospital or the orphanage, and the blood they were using was donated by soldiers who were coming back from various Soviet-related wars, who a lot of whom had various STDs. So this caused a huge issue in Romania. To add on to this, the Romanian government was suppressing doctors who knew about the problem and basically telling them to shut up or lose your license, that sort of thing, instead of actually deciding to deal with it. So it wasn't until the early 2000s that Romanian model HIV projects had started being successfully implemented in Romania, and now those models are applied today in Africa to deal with HIV crises there in children. So when you take all these factors into account and you look at all the different neglect and abuse I experienced, You can start to see, based on the adverse childhood experiences chart here from the CDC and Kaiser, that I've meet quite a few of these. So let's take a look. Black out the ones that I don't meet, or no, I don't meet. These are the ones that I do meet for a variety of reasons, both within and outside of the orphanage. I meet 6 of them, and most orphans will at least meet the physical and emotional neglect, and due to potentially high rates of physical abuse, sexual abuse, and emotional abuse in orphanages, it's possible that I met up to 9 of these. So these adverse childhood experiences are associated with quite a few significant negative outcomes in life going forward, including like decreased annual income and increased psychosocial problems. I mean, it's not exactly a perfect system with these ACEs though. Just due to the nature of not having parents, some of those categories can't really be met for orphans. But it's one type of model that we can actually use to try to understand how and why orphans face issues going forward. I'd like to go into a couple of conditions here that will be important going on, that are frequently studied and have been shown to be common in orphans. And these diseases had a lot of the research coming out of remaining orphanages. The first one is reactive attachment disorder, which is essentially a child who attaches really, really poorly to their parents. This is a child who withdraws from their caregivers. They have serious social and emotional disruption. They're kind of flat affect, can be unruly, don't care about their parents. And these things have to be connected to insufficient care, and they also cannot be autism. And you also have to be relatively young when you actually have these happen. And the other one is disinhibited social engagement disorder, which is sort of like the opposite to reactive attachment disorder, where children attach way too freely. This is a child who doesn't check back with their parents. They don't respect interpersonal boundaries. They just sort of go off with strangers all they feel like. And it also has to be connected to the extreme pattern of insufficient care. So those are 2 different patterns that can come out of this, and we'll see more of those later. So what kind of adverse health outcomes can an orphan have? Abnormal psychology, like we just talked about, and other patterns we'll see. The indiscriminate friendliness, which may be DSED, and it may also just be general trait behavior where they have indiscriminate friendliness towards everybody. And quasi-autism, which we'll also get into, but it's autism-like behaviors that present in orphans. And all these issues tend to be relative to time in an orphanage. And if we look at my own psychology, it's hard to say exactly which one of these meet. I never had any formal diagnoses and really never had any formal encounters with healthcare professionals about my childhood issues. But I tend to err on the side of reactive attachment towards my parents, but then also disinhibited social engagement traits towards people who aren't my parents. And a lot of those have been worked out over time and a lot of trust building with my family. But even nowadays, I still tend to be a very open and friendly person, which may just be personality trait and also may still be attributable to being an orphan at that time. So let's take a look at some specific research that's been done into this. There was a study done on taking fMRIs, functional MRIs, of the amygdala of orphans, basically looking at when they looked at a picture of their mother and when they looked at a picture of a stranger. And based on this chart, you can see the comparison group being the normal and the PI being post-institutional children. The amygdala response to mother versus stranger in a post-institutional child is equivalent. And this could be equated to the indiscriminate behaviors based on their study and on questionnaires. So what this is kind of saying is that the amygdala, which is more of the fear and emotional response center of the brain, responds identically to when it sees a caregiver versus when it sees a stranger. And you can see how if you thought both of those things were the same thing in your mind, a stranger and a caregiver, you could either become reactive to everybody or disinhibitedly friendly to everybody. And that's a potential mechanism for how people develop those conditions. And those indiscriminate behaviors that they'll show that correlate to this study include the things like in DSED, where they'll wander off from their parents without wanting to come back, they'll go off with strangers, or they'll trust new adults too much. Some other examples of neurophysiology that you can see that all sort of correlate together. You'll start seeing the connection soon. PET scans showing reduced limbic and brainstem activity in orphans, EEG oscillation activity changes, which are centered around things like gamma waves that can be associated with transmitting local info to other brain areas, and this tends to be associated with the corpus callosum. Diffuse tensor imaging showing white matter alterations, which tend to be favored in the sensory and limbic areas of their brains. And MRI studies showed reduced total brain volume into adulthood in especially the frontal cortex. So you see all these sort of connect to certain areas of the brain, and those areas being the limbic system, the emotional and attachment pathways, as well as decision-making pathways in the frontal cortex and transmission of information like the corpus callosum. And now we'll get into a little bit about the quasi-autism-like behaviors. So one of the major studies on this showed that within orphans, they were showing 11% of them having quasi-autism behaviors, while nobody who wasn't in an institution had quasi-autism behaviors. And this was after excluding people who had official autism diagnoses. So what did these children have who had been in an orphanage? They had impaired theories of mind, and a theory of mind being essentially your ability to understand the emotional state and thinking processes of another. So how could that present? A person with a disordered theory of mind may not understand when somebody else is bored or tired of them, or they might think that they're thinking the wrong emotions than the ones they're really thinking. They'll also show poor social communication, such as the behaviors that you see in autism, where they don't have appropriate reciprocity to when you're talking to them. They don't show emotional consistency with you, and generally just aren't able to function socially as well. They'll also show, these children were showing stereotypies, which are repetitive, purposeless movements that tend to be associated with self-stimulating sort of behaviors or issues with neglect. But what's interesting about this quasi-autism behavior is that instead of autism spectrum disorder, where these behaviors continue into adulthood and they maintain them, typically by 11 within the study, and even further they found that these behaviors would start to go away, and a lot of them would completely disappear. And what would happen is, instead of retaining autism-like behaviors, they actually started to present more like DSED as they grew older. Kind of just an interesting point to look at. This is sort of like an induced autism state, not connected to genetic factors as far as we know, but it's also possible that these children who, if they have a propensity to develop autism genetically, when you put them through an orphanage, it could increase the severity of it to the point where somebody who normally would present normally has some minor autism-like features. There's also a bunch of behavioral problems that children post-institutional have. Most children in most of the studies that I saw were showing few long-term pervasive issues, but the ones who did would show internalizing issues such as anxiety, depression, self-image sort of worth issues. And they'd also show externalizing problems, and those being things like giving attention to others and their social functioning. And what typically is shown in this study and many others is that being adopted later causes more severe deficiencies, particularly after 24 months. So by being adopted around 12 months, I manage to statistically escape a lot of these issues. And let's talk a little bit about now. So Romania now, they've been trying to get rid of the institutions for a long time. This right here, the National Strategy for Promotion and Protection of Child Rights, is a declaration where they wanted to deinstitutionalize completely by 2020, which has clearly not happened, because there are still, as of 2018, 6,600 children in 185 institutions, many of whom are children who are difficult to adopt out, essentially children with functional disabilities or mental disabilities, developmental delays, that kind of thing. And what they're seeing, one of the big issues with this is there's a lack of rural support, where areas that are away from urban centers just don't have the resources to be getting these kids adopted or taken care of or placed into good foster care. And a lack of post-institutional support, where once a kid, since a lot of these kids are my age now, not so much kids anymore, from the 90s, they aged out of the adoption system without ever being adopted. So they turned 18 and got kicked out. Well, what happens when you get kicked out at 18 when you don't have any training, no skills, no functional development, and severe deficiencies? A lot of them end up on the streets, or they ended up in prison systems. And there's no post-institutional follow-up to make sure that these kids do well in society, even if they're not adopted. So what can we do about this? Well, one interesting study was the Bucharest Early Intervention Project, which is a randomized controlled trial where they randomly assigned a certain number of people to be institutional children in Romania, and they assigned a certain number to be part of a foster care system. And through very rigorous follow-up, they managed to show that these kids placed in foster care were doing significantly better than the children who were placed in the orphanages. But the issues with this is that they were only finding these successes when they had very well-trained foster care individuals. These foster care parents, essentially, were being fully paid as if they're real employees for foster caring. They were being supported regularly by Romanian social workers with frequent contact, support groups, doctor visits, guaranteed health care, that kind of thing. So this was sort of the idyllic circumstance that you could be put into as a foster kid. And you compare it to the US system where people aren't really trained as if they're true professionals for foster care. The children are frequently changed as to which household they're in, and they're not treated like stable, loving relationships. So when you do use these sufficient foster care methods, you show really, really good outcomes. But the problem is finding a way that these children can be placed in this without massive economic burdens that the Romanian government simply can't afford relative to all their other issues going on. And they also found through the study that the younger you're placed means you tend to be better off later, which makes a lot of sense. So what do you do? Let's say you are a care provider and you taking care of somebody who is an orphan or previously an orphan. Most of the time, you probably aren't dealing with their specific orphan health issues. So what do? You respect them. They've gone through a lot. They may have come from an environment that you may not possibly understand. And you give them the respect and the time and the care to learn about who they are and what matters to them. You don't judge them as best you can. These children or adults that you're seeing have gone through significant life experiences, and they might come to you and be emotionally distanced or reactive against people who are trying to care for them, but it may be as a result of severe neglect in childhood. So it's not the place of the provider to judge them for who they are, but to try to take care of them best as when they come in. Try to understand that they've come through these complicated places. And if you actually are treating orphans, you can try various techniques in psychotherapy to try to help them and their parents. If you're dealing with a family who's recently adopted a child, it's going to be a multifaceted approach to try to deal with the parents and train them on how to take care of a child, as well as dealing with the child and try to engender into the child behaviors of a functional relationship and show them that people can care about them. Just to give a couple of specific strategies you can try to apply that are well evidence-based. Trauma-focused cognitive behavioral therapy, since being an orphan and neglected that severely is essentially chronic trauma, you can try this focused individualized therapy that I won't go too far into here. But essentially this TF-CBT has shown in major research that there's benefits on both the child and the caregivers. So you train the child and you train the parents, and the parents feel like they're confident and successful parents, so their confidence goes up, and it helps the child because the parents are also more confident and able to care for them. And it even shows benefits when you use this therapy on adults who have previously been victims of child abuse. So you can take a child who's been in an orphanage and now is even upwards of however old you want, and go back and look at those things and how it affects them now and try to care for them. Another option is parent management training, which is another evidence-based approach for targeting caregiver interactions with their children. And this support has evidence supported in major reviews for real-life applications, and it also shows benefits on caregiver psychology like the LAST therapy. So these are just a few of the options that you can use that I won't get into, but it's something to keep in mind in case you ever come across somebody who was an orphan and needs therapy nowadays to deal with it. And even if you aren't somebody who's specifically taking care of orphans, it might give you a place that you can bridge off to refer them to care that can actually help them and identify these issues. And as a fun last note, I'm actually in a book on Romanian orphans. my progression in Romanian orphan research and presentations dates back before I even knew I would have been part of this stuff. You can see sort of on the second paragraph here, it references my parents, Craig and Laura from Ohio, who adopted a child named Tobirio, which is not how you spell my birth name, Tiberiu, but they tried. The author tried. And it also mentions Rodica, which were the woman who chose me and also who my parents stayed with in Romania. So it's just kind of interesting that I'm actually in a book on this, and I found this book while researching for presentations like these. And this book was by Dr. Victor Groza, Daniela Eliana, and Ivor Irwin. And I've actually talked to Dr. Victor Groza about this book as just sort of a curious aside. So that's essentially all I have. The only final note I want to leave you with is that when you get a patient, any sort of patient, or if you're not a care provider specifically, any sort of person, you don't know their backstories, you don't know necessarily where they came from, and it's hard to judge that just from appearances. And you don't want to make interpersonal judgments based on people you don't meet, you don't know enough about. So if you didn't know that I was an orphan and I came to you as a future medical professional, you would probably think, oh, this is just a normal child raised in a normal household, and you would never know that I was a Romanian orphan. And you might see another person who's completely dysfunctional and has no ability to connect with people, and you know they're an orphan and you assume that's why. So I think it's important to not judge people and not assume, and to try to care for them as a person the best that you can. If you have any questions about this, normally I would ask them in person, but I can't do that through the video. You can contact me at kylebertia@gmail.com, and I will do my best to get back to everybody who asks me questions. I've talked to many people who are care providers and even former orphans of other kinds who have had questions, philosophies, and things they wanted to talk about, so I'm always open to that. And the last thing I wanted to show you, I have reference slides to reference all the data, so you can pause on these screens and look at these things. These pictures and stories were all provided by my parents, and you can see the rest of the resources that I've cited. I'd like to thank you for all your attention here. This is a very important and meaningful topic to me, and I care a lot about this, and I'm glad that you cared enough to watch this too. Thank you.